Welcome everybody to another episode of our weekly Q&A. My name is Talon Ellithorpe and I'm the practice manager at Tustin Longevity Center. I am not one of our physicians, and normally this time every week we have one of our physicians sit down and take live questions that you can ask right now in the comments section of YouTube. But this week, Dr. Ellithorpe is wrapping up a conference that she's attending in Tennessee. She was at the ACAM conference, so she will be back here next week at 9:45. We do this every week from 9:45 to 10:15. So please join us then. Plan and bring your questions. Any medical questions are certainly okay. And again, this would be general information about health. No specific, well, you can ask your specific questions, but the doctors will be answering it for the benefit of general information to the public. Of course, if you have specific questions about health, integrative medicine, we strongly encourage you to make an appointment with one of our excellent providers here. We have 5 of them. Dr. Ellithorpe is our medical director. We have Dr. Mitchell, we have P.A. Patel, Dr. Merrick, and Dr. Kaur. So we'll be here again next Wednesday at 9:45 until about 10:15. We also have a monthly seminar, and our next monthly seminar will be Thursday, November the 8th. It's usually about the first Thursday of the month, and that we do live here in person at 7 o'clock, and we have patients in the local area come and join us. And it's a similar format. We try to make it interactive and ask questions from the audience or have the audience ask us questions, but we also broadcast that live here on YouTube as well. So if you can't make it, or if you're out of town, we encourage you to log in and watch that live, bring your questions, tell your friends about it. And then we post it on YouTube, so it's there for you to go back and view later. So you can go check and see what we've posted previously. To learn more about our company, you can go to our website at www.tlcdoctors.com, or you can give us a call at 714-544-1521, and our front office staff during business hours is happy to answer your questions or get you set up to see one of our doctors. Just to let you know, our IV department, where we do IV hydration, IV high-dose vitamins, is now open to the public. So you don't have to become a patient here first to get an IV. So what does that mean for you? Well, if you're starting to feel sick, or if you are sick, if you know that you're going to be traveling, the holidays are coming up, it is so great for me to know that I can come here. Sorry, we just lost one of our lights. It's fine. What's that?
You still look fine.
Okay, thank you so much. It's so great knowing that I can come here and get an IV and just really kick the butt out of anything that's I'm starting to come down with. I like to do it preventatively. If I know that I'm going to be on a long flight, if I'm going to the East Coast, I'll get an IV ahead of time just to give my immune system a boost. It really does make a difference. And the hydration alone, that volume of water that's going straight into your veins just makes such a difference in your health. Excuse me 1 second. I think I might sneeze. No, I'm good. Okay. All right. Okay. So that was the IV department. We're open to the public. And also just to let you know that we do have our own lab here in the office where you can come and get your blood work done. We send out any specialty tests outside of the office. And the lab is awesome, convenient. We have the best phlebotomist, I think, out there. And we have our own supplement department here where you can pick up prescriptions as ordered by the doctors. We also carry bioidentical hormones as well, too, in our dispensary. All right, and today's topic, while we wait to see if we have any questions come in, I wanted to talk to you a little bit about the cost of healthcare, how to plan for it, how to keep it as affordable as possible. And we certainly want to partner with our patients in that. We understand healthcare can be extremely expensive, and insurance can be very confusing in sort of navigating that. So this time of year, we're now in October of 2019, we're starting to wind down the year as we enter the holiday season, my favorite time of year. And for most of us who have insurance, that means that our deductibles are probably getting close to being met or already have been met. And so I wanted you to utilize that to your advantage, because now is the time of the year where you can really make those insurance plans start to work for you. go in and see your healthcare provider, get those lab tests done. I know I don't always think about it this time of year, but now's the time of year to really take advantage of that. And it might not just be your deductible as well. If you're in a family plan, there's usually a family deductible that can be met or maybe has been met. Or if one person in your family has medical expense, maybe it's already been satisfied for the whole family, meaning that there should be very little to no out of pocket to you once your deductible has been met. So one thing that we encourage our patients to do is know what kind of insurance plan you have, right? I was just speaking to Mandeep, who's our practice administrator, and she was used the analogy of car insurance. You want to know what your car insurance policy is so that if you're in an accident, you know how to put it to best use for you. And that is when you make a decision what insurance plan you're going to get, you're weighing the cost benefit of how much is my premium going to cost and then what's it going to buy me, right? The higher the deductible, usually the lower the monthly premium, and you're sort of betting that I won't probably go to the doctor all that often or need anything major. As that premium price increases, your benefits and when insurance kicks in is usually sooner and lower dollar amounts. So certainly take some time to review your insurance policy. Now is a great time of year to do that and see where you're at with your deductible, what your insurance covers, whether it's does it cover labs? Does it cover office visits? Is there a copay? Is there a co-insurance, which usually is a percentage, and those types of things. So get into your healthcare provider if your deductible has been met or is close to being met. Now is certainly time of year to use that. Speaking of that as well too, we have a lot of patients that come to us with HSAs or FSAs. That's a health savings account type of insurance plan, or I should say it's an account attached to a certain type of insurance policy. And then there's flexible spending accounts, FSAs. Similar but very different. The first major difference is they're both great and they both have their place, and I certainly highly recommend you go out there and check it out if it's an option to you. FSAs, flexible spending accounts, are use it or lose it. It's something that both of these policies have tax advantages to putting money into them, either your own money or sometimes your employer will match what you put into it or they'll contribute to your plan. So check and see what your employer offers. The government incentivizes us to take some responsibility in our healthcare and to set aside dollars to take care of ourselves when we need health insurance. So with what they call high deductible health plans, and high deductible can be anywhere from around like $2,500 and up. I think my personal deductible is somewhere around like $5,000 a year. That's what I have to spend out of pocket before my insurance kicks in. But because my deductible is so high, my cost of insurance on a monthly basis is low or lower than it would be if I had a low deductible plan. For me, that works because I take my health very seriously, but I treat it preventatively. I sort of, to use a car analogy, I make sure that my oil's change frequently, that the tires are getting rotated. I treat my health the same way, and I know that I probably don't have to go to the doctor all that much, maybe twice a year, and certainly I'm not expecting anything major to happen to me. So I can attach to my plan because it does qualify for an HSA, the health savings account, or an FSA, flexible spending account. So why does that matter? Well, you can put dollars into an HSA or FSA on a pre-tax basis. So that basically means whatever effective tax bracket you are in or marginal tax bracket you're in, you are saving the tax that you would have paid on that. So just for nice, easy round numbers, let's say that you make $100,000 a year and you're taxed at an effective tax rate of 25%. If I can push into a plan $5,000, that's $5,000 that I would have been taxed 25% on in that example. So HSA plans are great because you can keep putting money into it. You don't lose any of the dollars you put into it. They roll over year after year. So if you don't use the money, you can roll it forward to a future year. And those dollars, of course, have to be spent on a qualified health expense, so you can go check and see what the IRS considers a qualified health expense. But I love HSAs. They have a triple tax benefit. Basically, money that you put in is tax deductible. The money gets to grow, tax deferred. You can actually invest those dollars in the market, in a mutual fund, in an ETF or something similar. And then as long as you spend the money on a qualified health expense, it's tax-free too. So I don't think there's hardly anything out there that has so many benefits attached to it. So I try to utilize my HSA to the best of my ability. And I actually don't like to pay anything because I'm expecting someday to need to use those health spending dollars. We know that we're all going to eventually have health challenges some point in our life. So I'm setting dollars aside in that. FSAs, on the other hand, the important difference is with a flex spending account, if you don't use the money in the account, you lose it at the end of the year. Now, there are a couple exceptions, and sometimes depending on what your employer has decided, you might get a bonus 2.5 months into the following year to use up that money. Or there is another, or you can roll over like $500 into the next year. It's one or the other, not both. So if you have a flex spending account, you want to make sure you use those dollars. So again, coming up on the end of the year, you can spend those FSA dollars at our office or on qualified health expenses. One of the reasons when you come here, if a doctor prescribes to you nutraceuticals, vitamins and such, they'll attach to it diagnosis codes, and it's actually a prescription that the doctor's giving you here. Because normally over-the-counter medicines are not covered, but not a qualified health expense either for HSAs or FSAs unless they're prescribed to you. So we provide our patients with what we call a nutrition prescription form. And that is usually good enough for you to keep as paperwork or to turn in as proof of a qualified health expense. So use those FSA dollars because it'd be terrible to put money into it and then not to get to enjoy those and spend those. Blake, how are we doing on questions? Any comments? Anything coming in?
Yeah, we just have one question so far. They're asking if we take health shares such as Christian healthcare ministries. They want to come to our clinic. My health share will reimburse anything over $500. Will the clinic work with me to get consulted and test covered?
That is a really good question. The question surrounds this newer sort of concept, at least newer to us, of health sharing or health expense sharing. It's not health insurance. And we've had some patients bring this up to us. MediShare is one of them. They're often associated with like a church or a faith-based organization for different reasons. Sometimes the people pool together their expenses and they disagree with what the public health insurance market covers or doesn't cover for religious or ethical reasons, right? I believe doctors' offices, certainly doctors' offices like ours and the integrative or more forward-thinking, are trying to figure out how to best utilize these. There is a caveat, though, that we're finding. When you're pooling together dollars to create this basically private type of health insurance, it's there to be more catastrophic coverage for the big things that you're not expecting. You can't really think about it like health insurance. Like every time I go to the doctor, I'm just going to use this policy and it will cover or it should cover a percentage of what I'm getting done. Even more so at an office like ours, where our doctors are not really playing by the rules of what health insurance covers. And what I mean by that is our doctors believe that if you only do what insurance pays for, that you're going to wind up with the same results that everybody else is getting utilizing their insurance. So it's a little bit of a mind shift to take more responsibility in our minds to do things that we know are good for us or that are preventing disease. And I'll get back to answering that question, but that brings up a side note of something that we see a lot with labs and a confusion point that comes up with patients. A patient will give us a call or give our medical billing team a call because they said, hey, I had this blood test done. My insurance told me it was covered. They're denying it, and they're saying that you didn't provide the right codes. What's going on with that? When we partner with an insurance company, we actually go into a contractual relationship with them, and we agree to accept a certain amount. And when you choose an insurance policy for yourself, you're choosing the deductible and the price and such. And the insurance company will tell you what is covered. But coverage simply means that it's billable, meaning that there's a code for it, and they have an allowable amount, means what they'll pay for it for in-network providers. But that does not necessarily mean that it's going to get paid for, because that needs to be matched with an appropriate diagnosis code, and or maybe that service is only covered under specific conditions, like once a year, or once every 3 or 5 years. So don't be fooled when you call your insurance company to see if something like a hemoglobin A1C or a vitamin D is covered, and they tell you it's covered. Oh, good, that means it'll get paid for. Well, not necessarily. So that was a little bit of a tangent. We're talking about the Medishare thing, and we're finding when we try to bill Medishare for these preventative services or regular checkups, most of the time they're not providing any type of member benefit to the person in that policy. However, they're still great because they sort of check that box, is my understanding of, since the Affordable Care Act, Obamacare, you have to have health insurance, otherwise you pay a penalty. Plus it checks a checkbox of a group of like-minded people that I can align with ethically or morally, and it's there for the really big bad stuff. Car accidents, major medical, chronic disease. But we haven't quite figured out how to work with them on the routine labs, doctor visits and such. We're still looking into it. And certainly if anybody out there hears anything about how to utilize those more routine services, please do bring it to our attention. I hope that answered your question.
Yeah, they just had a follow-up of, basically, if we do accept Medicare programs, which do we accept?
Medicare programs?
Right.
Okay, so we are Medicare providers, meaning Medicare Part B. We are not, Medi-Cal providers. So if you have typical Medicare and you haven't signed up for Medicare Advantage, which is like when you assign your Medicare benefits to another insurance carrier. So Medicare Part B, straight Medicare, railroad Medicare, we are in network with. Medicare Advantage, not always, usually not. Any type of HMO that has taken over your Medicare policy, we're not in network with. And the Medi-Cal, we are not in network with. But most PPOs and straight Medicare, we are in network with. And we love Medicare. We think Medicare is great. And once you qualify for it, absolutely take advantage of it. It is actually surprisingly one of the better insurance policies out there in terms of the percentage of cost sharing that they cover in network.
That's all the questions.
Okay, great. Let me just check my notes here and see if there's anything else that I did not mention. We sometimes get asked a question, although certainly we're not tax experts. We could make some recommendations to you. Are medical expenses tax deductible? And certainly you'll want to talk to your tax professional, but I think the important thing, whether you have an HSA, an FSA, or you're interested in deducting your expenses for healthcare from taxes, it all starts from the place of keeping good records. So we certainly try to do our best on our end, and that's one of the things we love about our EMR, where our doctors store the records, is everything is right there. What they diagnosed and when, and what the amount charged to the patient was. Keep those records on your end of what you spend throughout the year, and bring that to your tax professional, like a CPA or an accountant. And then they'll be able to tell you if your medical expenses are covered or not. The rules change every year. It used to be if your medical expenses exceeded 7.5% of your adjusted gross income, everything above that was deductible, if you are itemizing on your tax returns. So without getting too much into detail on that, first of all, the rules changed. Now I believe it's 10% as of 2019. If your medical costs exceed 10% of your adjusted gross income and you itemize, then you can deduct the difference. So adjusted gross income is not how much money you make, that's how much taxable income minus deductions. So you might make $100,000 a year, But if you're itemizing and you have deductions, maybe that brings you down to 75,000 of AGI. So it's that number. So in 2019, if your medical expenses exceed 10% of your AGI, in that example, $75,000, so $7,500, everything above $7,500 would be deductible. So that's a question we get a lot. I hope that if you've ever wondered that, you can talk to your CPA about that as well too. Other than that, I would just remind you, we're here every week at 9:45 a.m. Next week, thank you. Dr. Althorpe will be back, and she'll be on this side of the camera to answer your health questions. Hope to see you then. And on Thursday, November the 8th, we will have our hour-and-a-half long-ish lecture here on site. You're welcome to join us if you're here. We certainly encourage that. We love having a live audience, but we will be broadcasting live on YouTube as well. Any last-minute questions come in, Blake?
No more questions.
All right. Well, thanks for joining us. Hope I didn't get too far off on tangent or anything, but we're here to answer your questions and look forward to seeing you this time next week. Thank you.